According to the Wall Street Journal, 1.2 million Medicare Advantage plans are being canceled in 2026. Add to that, a lot of insurers are now pricing for profitability instead of market share, which means that prices are going up. In this video, I'm going to give you a really clear picture about what's happening with Medicare and, more importantly, what you can do about it. Coming up next on Holy Schmidt.
Holy Schmidt!
1.2 million Medicare Advantage plans are projected to be canceled in 2026. That's a big number, and it puts a lot of Medicare recipients in a position where they need to shop their Medicare Advantage plan during annual enrollment period, which is right now. But why is this happening? And more importantly, why are rates going up at so many different health insurance companies that provide Medicare Advantage plans? 2026 is the first year in 15 years that there's a projected decrease in enrollment in Medicare Advantage plans. And by the way, whenever there's a decrease in enrollment in Medicare Advantage, it's usually driven by customers. There's something bad happening in the system, and they're making other choices. Still, with 33 million people on Medicare Advantage plans, it's a very lucrative market for health insurance companies. And so why are the things happening that are happening? Well, let me explain. Right now, insurers are moving from what's called a growth strategy to what's called a pricing for profitability strategy, which means that they're not just trying to capture market share. They're trying to now make money on Medicare Advantage plans, or more money, probably, with many of them. So why is this happening? Well, first, the Inflation Reduction Act put in place caps on the amount of out-of-pocket the retiree could pay for drugs. And so that cap basically meant that anything in excess of the cap was paid for by the insurance company. Well, if the insurance company can't charge you more for out-of-pocket costs, they can charge you more by raising your premium. And according to the Bureau of Labor Statistics, medical inflation is running about 3.9% for the 12-month period ending September 30th, whereas the cost of living adjustment, which was just announced for Social Security, is 2.8%. Now, that may not seem like a big amount, but that means that medical costs are rising a third faster than inflation, which is a big amount when you're talking about an insurance company. And a big trend is that people are getting caught up on their medical care post the pandemic. People didn't seek a lot of medical care in 2020, 2021, and part of 2022, and this started to increase in 2023, definitely in 2024, and in 2025. So not only are medical costs going up, but utilization is going up, and some of that utilization is catch-up. And some regions are just having higher medical loss ratios than they used to. That's just the nature of health insurance. And it could be caused by a lot of things. It could be caused by a hurricane, who knows? But the point is that because the medical loss ratios are higher, some insurers are getting out of that region. And there's stricter CMS oversight, particularly around prior authorizations. Now, what does that mean in English? It means that when you go to your doctor and your doctor refers you to someone else to have a procedure done or have treatment done, that procedure or treatment still needs to be authorized. The way to reduce the cost is to restrict the number of approvals. Well, the CMS doesn't like that too much, obviously. And so they're cracking down and they're saying, no, I'm sorry, you can't do this. If there is an approval that's needed, you can't slow walk that approval. You can't deny that approval. You need to approve the treatment. And because insurance companies now have higher oversight, that means that they're paying for more. And because they're paying for more, it changes the profitability. And some regions are actually unprofitable. On top of that, there's payment reform that's happening, which basically means that the government is looking at the insurance companies and they're making sure that they're not overpaying the insurance companies for the reimbursement from the government for services provided by medical doctors and medical staff. Gang, we're in the annual enrollment period between now and December 7th, which means that if you want to check your options when it comes to Medicare, now's the time to do it. And given what we're talking about in this video, many of you might be affected by either higher prices or policy cancellations. If this is the case, give our partner at Chapter a call at 440-703-1224. The cost is totally free to you. They save their clients an average of $1,100 per year, and they're actually pretty easy to work with. It takes about 20 minutes. The third reason is that there's been marketing and transparency reforms that have been put in place that have been rolled out throughout 2024 and 2025. One of the first reforms is the requirement to record an enrollment call. Now, when you are a Medicare advisor, if you're not necessarily covering everything on the checklist because you're trying to get through it, or maybe you don't want to cover a point or two on that checklist, that will be captured on an enrollment call. So this forces companies to spend more time focusing in on the discussion to make sure that the disclosure is adequate for the conversation. Appropriate is probably the better word. Next, restrictions on confusing marketing and deceptive branding, which basically means a reduction on something like motherhood statements. What are motherhood statements? They're statements about things that are nice but don't really hold any water. Politicians make motherhood statements all the time, for example, and these are things like we should reduce crime or we should increase public transportation. But there's no promise there, but it sounds like there is. Because of these types of practices, historically, deceptive marketing has become a focus point for the CMS. At the same time, there's been a crackdown on overpromising of perks that don't materialize. Medicare Advantage plans have things that are attached to them that traditional Medigap plans don't, oftentimes anyway. And because of this, a lot of the perks are not standardized, and people think that they're getting one thing when they might actually be getting another. And then there are changes to the plans themselves. If you want to keep prices down, you can do it a lot of different ways, one of which is to change the nature of the offer. So you go from a PPO to an HMO, or you increase the size of the deductible, or the copay, or the coinsurance. There are a lot of things insurance companies do to improve profitability, but the customer is the one that ends up getting hurt. Next, there are provider network issues. Now, what are provider network issues? Doctors, hospitals, and medical staff that you expect to be on the plan, you are told they're on the plan. When you go to utilize the service of the Medicare Advantage plan, you find that the doctor isn't on the plan, and they weren't even on the plan when you signed up, but you were told that they were on the plan, or staff that you enjoy working with are on the plan and they're not. Or a hospital, on rare occasion, is supposed to be in the plan, but it's not. And why is this happening? Well, just as insurance companies are making decisions about individuals, hospitals and doctors are making decisions about insurance companies. If the insurance company isn't providing adequate compensation, they simply won't accept that provider in the following year. Also, authorization disputes. We talked earlier about authorization disputes from a customer side, but also the medical provider oftentimes will give treatment based on the fact that they think the treatment will be authorized and the customer needs the medical treatment, only to find that they're not authorized and they're not going to get paid. So what can you do about it? Well, if you're impacted, you should talk to a Medicare advisor. We partner with Chapter. We think they do a great job. But even if you don't use Chapter, you should talk to somebody, because the worst thing that you can do is do nothing. If we're talking about not just rates going up or benefits being cut, but an insurer actually pulling out of your region, then you actually do need to do something. If you have an interest in talking to Chapter, you can give them a call at 440-703-1224. As I said, they're very easy to work with. It takes about 20 minutes, totally free to you, and they save their clients an average of $1,100 per year. If you like this video, check out that video, 5 big changes that are happening to Social Security in 2026. Also, if you haven't done so already, download my free Social Security quick guide. It's free. It's my gift to you. You can find it at holyschmidt.com/quick guide. This is Jeff Schmidt, and I will see you in that video right there.